this one is a little bit more challenging. So we have talked about perforation, but from the idea of the chest. It would be great if someone could tell me what they think this one is, but we'll go through it anyway in the meantime. So what we have is an abdominal X-ray. So generally speaking, we would say something like, we'll be looking for air-filled bowel obstruction, because if you don't have air-filled bowel obstruction, i.e. air within the bowel, then you don't have the interface between soft tissue or the tissues around the body. Exactly right. Well done. So you don't have that typical appearance of the interface. You need an interface between densities to be able to see things. So if the bowel is fluid filled and obstructed, you may not be able to see that. So that's why whenever I report these, I'd say something like there is no air-filled bowel obstruction. When you look at this particular one, you can see that the large bowel is going to be on the outside, and somewhere in the middle of all there is going to be the small bowel, just generally speaking. But when you look at this transverse colon, you can see it's very, very sort of irregularly contoured like so. It feels like, yeah, exactly like someone said, like someone stuck their thumb, pushed it in there and made a bit of an indentation. So this basically means that they've got what looks like colitis involving the transverse colon, and that can happen because of ulcerative colitis or anything. It doesn't have to be ulcerative colitis, but it could be inflammation because of infection, ischemia. There's so many reasons that someone could have inflammation of the bowel. But the important thing to understand is that this sort of irregular appearance to the bowel wall contours is not normal, and therefore this would be indicative of colitis. And colitis will therefore lead you down a different road. Obviously, if you've got someone who's got ulcerative colitis, you might want to do further imaging depending on how bad their pain is, because if someone has got ulcerative colitis, they can end up having perforations. They can end up having perforations and collections. So it's still can be quite important to get cross-section imaging in patients who are known to have regular episodes of colitis, especially if they come in with a significant bout of pain.